Hi, welcome to Valley View University. My name is Julia Koch, and I'm a physical therapist specializing in orthopedics.
Welcome. Appreciate everyone joining us. I'm Dr. Chris George, orthopedic surgeon with ValleyOrtho. I specialize in sports medicine as well as joint replacement, focusing on hip and knee surgery. And appreciate everyone joining us tonight.
We have a few housekeeping items to address before we get started. You can submit questions through the Q&A chat at the bottom of your screen. Your question could be answered live at the end of the presentation. We will try our best to answer your questions. We are unable to answer questions regarding personal health information. All right.
All right, good evening. Thank you for joining us for this presentation on agility training tips for longevity. The intention behind this presentation is to optimize your function with tasks that you perform on a regular basis. A disclaimer, this content is only for informational purposes and should not be used in place of an actual doctor's visit. So objectives, what is agility? How to train agility? Benefits of power and plyometric training? How to find exercises to match your ability? Examples of plyometrics? And when to seek a healthcare professional for medical clearance or additional guidance. So what is agility? Agility is the ability to rapidly and accurately change the body's position, velocity, or direction in response to stimulus, requiring a combination of balance, coordination, speed, and reflexes. In this, we'll go back to the slide. This picture of the dog on the agility course, you can see that he's standing on one leg. He has the strength, balance, and power to stand and push off of one leg while quickly coordinating his change of direction to seamlessly weave between the poles. So in order to train agility, we're going to go over power and plyometrics. Power is your ability to generate maximum force in minimum time. So it's a combination of strength and speed. Plyometrics is a progression of power that utilizes a quick lengthening of your muscles, quickly followed by a shortening of your muscles. So this would be a jump, a skip, or a bounce. Power and plyometrics both train to make your movements more efficient. Next slide. So we're going to review the difference between strength and power because you need to have a baseline strength in order to begin power and plyometric training. So strength training is your ability to lift weights with the purpose of building stronger muscles and bigger muscles, such as a kettlebell or a barbell squat. Meanwhile, as we discussed, power is that explosive movement over minimal time, with the higher progression being a plyometric or a jump. Next slide. So everyday activities that require agility and power include stair climbing, hiking, fast walking, standing up from a chair, getting off the floor, and standing upright if you take a misstep. You can also think of some higher recreational activities that require power and agility, such as skiing, pickleball, or fishing. So we're going to review some changes to your body as you age. In the upper right corner, there's a picture of a bulldog on the agility course, and that might be how you feel about jumping, but hopefully you'll learn some of the benefits of plyometric and power training, and you'll change your minds. So unfortunately, as you age, power decreases at a greater rate than strength or muscle mass due to fast twitch muscle atrophy and decreased muscle recruitment. However, powerful movements continue to be needed for everyday activities throughout the lifespan that we discussed in the previous slides. Fortunately, studies show that exercise is medicine, and the prescription of structured power exercises with older adults can be used to safely and effectively reach specific goals and improve function. So once again, we said that strength, power, and plyometrics are all interrelated and need to be trained together. In order to start a plyometric program, you need to have a certain baseline of strength. Go back. Okay, so once again, strength is your ability to lift a heavy weight with the intention of getting stronger and building muscle mass. Power is combining speed with the movement and strength. And then plyometrics is that quick movement, including jumping and skipping. You can go to the next slide. Okay, so now we're going to review the benefits of power training. So power training bridges the gap between strength and functional performance. When performed and progressed appropriately, lower body plyometrics strengthen the joints, connective tissue, and improve tendon health. It teaches the body proper force absorption and builds resilience. Can improve the quality of life by making everyday tasks easier to perform and building confidence with everyday tasks. It can also prevent injuries by being able to swiftly correct yourself if you misstep, possibly preventing a fall. Next slide. Okay, so I am going to review this study of age-adapted plyometric exercise programs compared to a resistance training group and a walking group, which was the control. This study included males between the ages of 65 and 80 years old. Participants were excluded if they had participated in a strength training program or a plyometric program the previous year, in addition to having certain medical conditions. This study showed that at 6 weeks, resistance training and plyometric training had similar strength increases. I would be curious to see a more long-term effect to see if strength training might outweigh plyometrics with more long-term commitment. Because in the first 6 weeks of an exercise program, your body becomes better at certain movements by coordinating and making movements more efficient. And that happens before you're even able to build muscle mass and increase the size of your muscle fibers. So the plyometric group was the only group to improve their power, measured by jump performance and stair climbing performance. Stair climbing performance was measured by how quickly a participant could walk up 6 steps without using their hands. So the next slide is going to review how the creators of the study progress the plyometrics, because this is really important in order to safely, so your body safely adapts to the new movements. I will say in the plyometric group, there was about 12 to 14 people, and there were three muscle strains. However, I do think that if you're watching this presentation, you have a stronger base than the participants of this study because they had not participated in a strength or a plyometric program in the year prior to participating in this study. Okay, so in the first 3 weeks of the study, the participants performed the jump movement at a regular speed without jumping. The second 3 weeks of the study, the participants performed a submaximal jump, taking a 5-second rest between each jump. The 5-second rest allowed for the participants to start the new jump without being fatigued so they could focus on proper form and prevent injury. The third 3 weeks of the study, participants performed a maximal jump, but they continued to keep the 5-second rest to safely perform the next jump. For the final 3 weeks, participants performed a maximal jump with no rest. And they performed sets of 6 to 8 repetitions. Next slide. Okay, so the takeaways of progression: start at a regular speed, progress to submaximal effort with rest, then a maximum jump with rest before progressing to a maximal jump with no rest. It takes time, but you also have to be comfortable to progress to the next step. Next slide. So I just want to go over some guidelines before starting a plyometric program. You should be low risk if you're free of medical conditions that do not impair your movement and you don't have pain or swelling. You have the ability to perform functional tasks independently, and you participate in recreational physical activities. You will require medical clearance if you have acute musculoskeletal pain or swelling, severe osteoporosis, significant balance impairments, and uncontrolled cardiovascular disease or other diseases. This list is not inclusive, so please use your judgment as well. Okay, so as we talked about, in order to safely start plyometrics and jumping, you need to have some baseline of endurance and strength. So when you're choosing a plyometric or a jump that you want to perform, the first thing you need to make sure is that you have the mobility to move your muscles and joint through that whole range of motion. Next, you need to make sure that you have the balance to sustain yourself throughout the entire range of motion. You also need to have the strength and control. So if the motion you're aiming for is a squat jump, you need to make sure that you feel steady at the bottom of the squat as well as at the top on your tiptoes. Once you can safely perform the motion, you've proved that you have the strength to safely perform the motion, then you can perform it with faster repetitions in order to prepare your muscles to work at a quicker speed and velocity. Next, you can start to add in some plyometric progressions. Okay, so this is just a quick slide on the American College of Sports Medicine's recommendation for increasing power in healthy older adults. And once again, it includes coinciding power training with muscular strength training, in addition to performing 1 to 3 sets of 6 to 10 repetitions of high velocity power exercises. Next slide. Okay, so building upon the checklist or requirements, once you can safely perform an exercise at a regular speed, you can try to increase the speed of the movement without compromising form. On the right, I have a few exercises to prepare for the jumps that we're going to be reviewing in a few slides. So you should be able to perform calf raises at a regular and fast speed, body weight squats, a step up, and a side lunge. Okay, so I want to review jumping safety tips before we start the demonstrations. It's always important to have a solid warm-up prior to starting jumping. You need to warm up for at least 10 minutes of moderate high intensity walking or biking in order to prepare your muscles for the quick movements. You're always going to start small and slowly build upon the motion. If you think about it, the bigger the motion, the more impact. And you want your body to learn and adapt to take to absorb the shock with bigger jumps by starting with a smaller jump. Bend your knees when you land. You can also think about soft and quiet landing. Always use assistance if needed. So maybe a counter or a strap or a chair. Stop when you feel fatigued, because we're always going to prioritize quality over quantity. Then, of course, just make sure that you're wearing appropriate shoes and apparel. Next slide. Okay, so the first exercise we're going to review is double leg hops. and we can move into the demonstration. Okay, so in order to prepare for this exercise, you should have been able to perform regular speed calf raises in addition to quicker calf raises. In addition to perform a regular squat with good control and a squat at a quicker speed. So to perform the double leg hop, you're going to stand with your feet about shoulder width apart and your knees slightly bent. And you're going to jump off the balls of your feet, focusing on a nice quiet landing and a nice quick springy movement. In order to progress this exercise, you can focus on a bigger hop or a quicker hop. You can also jump forwards and backwards or side to side. Okay. We can go back to the presentation and to the next slide. Okay, so the next exercise, jumping exercise we're going to review is a squat jump. We're going to review easier and harder progressions. So once again, we need to prepare for this movement the same way we would prepare for the hop, with the faster calf raises and squats. So the easiest version is a regular squat, followed by a squat at a quicker speed, and then performing something similar to what is shown in the slide picture. Oh, should I go back to review that? Okay. Or no, I wasn't on camera. Well, I guess I was on camera. We'll just keep going. Okay. Sorry, I forgot to change you're still recording. Okay, so we reviewed the squat and the squat at a quicker speed. So the next progression of the squat jump would be having your hips above your knees and having something in front of you in case you need any assistance with balance. Then in one quick explosive movement, you're going to jump up using the chair if necessary. You can rest 5 seconds between jumps to make sure that you're not fatigued and you have good form. The next progression is going to be a sub-maximal squat jump. Making sure you're resting so you can move into the next jump without fatigue. Then you can move to a maximum squat jump, continuing to rest between each repetition. Then, with time and as you feel ready, you can perform 6 to 8 maximum squat jumps with no rest. All right, we can go back to the slides. Yes. Okay, so the next demonstration is going to be on lower extremity jumping jacks. And once again, we're going to review easier and harder variations. So in order to prepare for the jumping jack, you should be able to perform a side lunge at a regular speed and a quicker speed. This is going to be important because you're moving your muscles quickly side to side, and you want to make sure that you have the flexibility to move in this motion. So the easiest progression of this is just going to be quick steps side to side. You can also add hand movements with the side steps. The next progression is going to be you can use a chair in front and something behind you as well to ensure you have the balance. And then you're going to jump your feet apart about shoulder width, and then your feet back together. You can rest as needed so you're not fatigued before the next jump. If you feel comfortable, you can take away your chair or the chair behind you or in front of you and perform some maximal jump out to the side. The next progression would be to do the same thing at a faster speed. Next progression would be to perform a regular jumping jack. Okay. And then also to make that harder, you can think about jumping higher with your jumping jack or going quicker. Okay, back to the next slide. Okay, so I did include some aquatic options for jumping in case you do not feel comfortable jumping on land. The pool will kind of help with balance, and also depending on how deep you are, it can be reduced body weight in order to help prepare your muscles and joints. So in this demonstration, the woman is just jumping forwards and backwards, but you can do any of the jumps that we reviewed, including the double leg hop, maybe jumping side to side, the jumping jack. If you are jumping in the pool, just be sure, like any other exercise, you're slowly progressing. So kind of count your jumps and slowly increase them between week to week. Once again, so your muscles and bones and joints can slowly adapt to the new forces and get better at absorbing the shocks. Okay, so with any new exercise program, you can experience delayed onset muscle soreness. So especially when you're performing something at a quicker speed and you're going into that stretch and shorten of your muscles. DOMS can last anywhere. It can present anywhere from later that day to a few days later, and it can last up to a week. But normally, it's considered a good type of muscle soreness. Okay, and to wrap up, it's important that you personally assess your mobility, strength, and endurance and balance prior to starting plyometrics or jumps. It takes time and consistency to prepare your body for more powerful movements, so be patient. Use assistance as needed and progress slowly as your comfort increases. And then ask for help from a physical therapist if you need assistance progressing through the checklist. So with mobility, with your balance, with your strength and control, quicker movements, or the jumps. You also, if you encounter pain with any movement or any phase of the progression, or if you need help to feel safe. Next slide. So, coordinating fast velocity movements improves muscle performance and resilience with predictable and unpredictable encounters. Every exercise has a different intensity, and you must have the appropriate base to start that exercise. Start small and progress over time as your body becomes more efficient. Okay, next slide. So that's it for the presentation. And now Dr. George and I will be here to answer any questions that you may have.
All right. First question, can someone do these exercises with weights?
So I would definitely do the strength exercises with weights, but with the jumping exercise, you could do them with weights, but I would recommend focusing on the quicker, more explosive movements. You can also perform power exercises. So the high velocity, so the high velocity, low resistance movements with weights. But if you do weights, you would use more like 40 to 60% of maybe your 1 rep max, which would be equivalent to something you can do about 15 to 20 times. A weight that you can do, for instance, a squat, you can do reps of 15 to 20 prior to reaching fatigue. So a lot of times I'll have patients perform strength training with a heavier weight, and then I have them decrease the weight and perform the same movement, but at a quicker speed. But I wouldn't jump with weights.
Could agility training increase my risk for an ACL tear as a woman?
I can comment on that. As Julie was mentioning, if you're new to agility training or you're doing something you haven't done before, there is a potential risk of injury. And so that's why you want to kind of progress up through this. On the other side of that, though, agility training is probably protective from an ACL injury standpoint, especially in females. There is a higher rate of ACL tears in females, especially in younger adolescent females compared to males. But there's lots of things that play into that. The strength and agility is a part of that. And so there are some training programs. This was initially developed in the soccer world. The kind of the most famous one, if you look up FIFA, I think it's FIFA 21 or FIFA 15, I'm not forgetting the number. 11. It's 11 players. I thought it was FIFA 11. It is a validated training program that focuses on agility, strength, muscle coordination that does decrease the risk of ACL tears. A lot of that from an agility and plyometric standpoint, one of the risk factors for the higher rate of ACL tears that we see in females is landing mechanics. Not so much the jump itself, but landing with your knees inside your hips or ankles puts more torque onto the knee that can increase risk of ACL tears. So again, having good mechanics and training that is probably more protective than a risky exercise or training aspect.
Yeah, and I would also mention that this presentation was really an introduction to beginning plyometrics. But if you are like participating in sports like pickleball, you can imagine how like reaching for, trying to hit the ball while you're changing direction, maybe jumping on one leg, how much agility that requires, and how starting slow progressing some of these jumps could help you prepare and be safer during these sports.
The other comment I would make to that is obviously there's a question about, does this help protect my knee or put me at risk of injury after an ACL reconstruction? If someone does have an ACL tear that does require surgery, a lot of the rehabilitation that Julie and her team does a great job of with our patients, outside of the initial post-op rehab, getting swelling down, pain control, getting range of motion things back, as we get farther out from surgery, a lot of that focus is agility, motor control, plyometrics, retraining those muscles in a protective sense. And so you can look at it on either side of that too. And so being proactive on it does decrease that risk of injury. But a lot of the rehab as we get farther out and advancing people back to full activity does focus on the exact same things that we're talking about here from an exercise standpoint.
Are there other exercises that help with agility that don't involve jumping? This individual has a neuro disease that causes a gait disturbance and they cannot jump. Currently, they ride a stationary bike and lift weights.
So yeah, so maybe it, depending on your intention with jumping, you might be someone who might seek an exercise professional or a physical therapist to make sure you're finding the right exercises that meet your ability, and you're doing safe variations and using the appropriate support. But in this presentation, I did like for the jumping jack, just doing the side step and holding on to a counter, and then maybe working on doing that motion faster or hovering your hands away, are some progressions that you can consider, assessing the checklist that we went over and assessing that you have the mobility and control and balance to do those. I think, if not jumping might not be for everybody, but just working on faster movements, in order to be able to react quicker, with day-to-day activities, and increasing the efficiency of your muscles can be helpful. In addition, we didn't really go over like change of direction, and challenge but there are other ways to kind of challenge your coordination, balance, and change of direction to improve your agility.
If someone is considering a knee replacement, how long after that replacement surgery could I do these types of exercise or generally get back to the activities I enjoy every day?
Great question. I think recovery certainly has some individual variation or one patient to another. Obviously, similar to what you mentioned with the ACL reconstruction recovery, there's a progression with this. This is not something where right out of the gate we're trying to maximize agility or power. Pain control initially, getting swelling down, getting range of motion back is going to allow that progression. What I tend to see in patients, as we're seeing in post-op, as well as within the first month to 6 weeks or so, is where most patients are kind of back to normal day-to-day activity, not necessarily jumping and agility training, but feel fairly comfortable for walking, starting to transition more from the PT standpoint into strength training and getting that power back. 3 months or so after surgery, that's kind of similar between hip and knee replacement, is where strength and coordination is getting more back to baseline. In a good way, joint replacements now are much more durable and much more functional long-term outcome. Historically, joint replacements weren't as durable, would maybe wear out or come loose or need a revision surgery within 10 to 15 years. And so we didn't necessarily recommend higher energy activity. Running, jumping, plyometrics wasn't really a part of expectations in the past. And I'm talking 15, 20 years ago now. That's not the situation now, especially for our patients here in the Valley that have the intention and the desire to go back to high level activity. Implants are much more durable now. Wear rates are almost non-existent to where I don't tell patients to avoid certain activities. And so it does take some time for that strength and coordination to get back to normal, but it's not a limitation of going back to jumping or impact activities. 3 months is kind of where strength and coordination is getting more back to normal, at least from what I'm seeing in the office. And Julie can certainly comment on what you guys see in the PT gym, but there's some studies, outcome studies and patient report outcomes that for hip and knee replacements, patients at 3 months after surgery, most I feel between 80 to 90% back to full activity and full recovery. That last 10 to 20% progresses all the way for a whole year after surgery. And so there's the acute kind of recovery in the first couple months from the surgery, strength and coordination, progressing back into agility, jumping, those things can be very beneficial, probably along that same timeline. But there will be improvements that would happen all the way for the whole first year after surgery, and that progression back to activity, whether that's specific exercise or plyometrics with physical therapy, or back into pickleball, jogging, running, other activities, is generally when patients feel comfortable to that. But in terms of more specific, 3 months is kind of that full recovery back to baseline for most activity that we see after joint replacement surgery.
So it's really helpful to know the durability of the newer or current joint replacements. Yeah, and I would agree, like you would want to make sure that you're meeting some mobility. You kind of met all your milestones, and your balance, your range of motion is there, you're not having pain, you have good control, you're demonstrating strength prior to starting some of this agility training.
So kind of a follow-up question to that one, should someone do those exercises to prepare for a replacement?
There's certainly some benefit to that. Prehab is oftentimes what we kind of call that or refer to it. I do think there's a balance to that too. Often as patients that are going into joint replacement surgery, obviously arthritis is the indication for that. They may have pain limitations as a factor more than anything else, to where some of these, especially impact or jumping or things, may be more difficult preoperatively. That being said, trying to maximize strength, mobility, endurance, things like that is just going to help on the recovery side. And so there are some patients that I think probably benefit specifically from some preoperative exercise and rehab. It's not a requirement necessarily. So it's not that there's a PT course that has to be completed before joint replacement surgery, but we definitely see a quicker progression in patients that go into the surgery with probably a better baseline fitness level. That doesn't mean that if you say, I just can't do the activity I want to do because my knee hurts or my hip hurts, you're still going to have a very good outcome from that. But there is certainly some benefit of trying to maximize strength and function and balance, muscle coordination, things like that is going to be, again, very helpful on the recovery and post-op side.
Yeah, I would agree that kind of focusing on your strength, your balance, your coordination is going to be more important prior to a surgery, because you're getting it because your pain is significantly impacting your ability to perform activities. And just remembering that plyometrics is a higher level exercise. So it might be a reason why you're getting a joint replacement.
Where do each of you see patients?
So as I mentioned, I'm an orthopedic physical therapist, and I work here at the Glenwood office, the outpatient Glenwood office at Valley View.
Our group of ValleyOrtho sees patients all throughout the valley. Me personally, I see patients in our Glenwood office that's here within Valley View Hospital. Our main OR is here within Valley View, so a majority of surgeries done here at the hospital as well. I see patients weekly in our Willits office. We also have a surgery center, an outpatient surgery center that's not in that same Willits clinic facility, but in that same Mid-Valley area where myself and my partners do a lot of our outpatient surgery and arthroscopic surgery. Just in terms of where our offices are all throughout ValleyOrtho, we do see patients also. We have an office space in Aspen. We see patients in Silt as well as in Eagle as well.
We don't have any more questions pop up. We can go and close this out. Our team would love to hear your feedback on today's presentation. If you have the time to fill out a quick survey, it will appear right after the webinar has ended. You will receive an email with the recording of the webinar within the next 24 hours. Valley View University webinars will resume at the end of the summer. Check vvh.org/VVU for up-to-date information. Thank you all for joining again today.
Thank you.